Good afternoon. Today is Monday, November 16th. And it's a little striking. It's been 2 months, nearly 2 months since my last video. Now it's pretty important that we come back and we share information. And we should start with the numbers because certainly if you watch the news or you Google news activity, you do see that across the country there's quite a bit of concern about COVID. Today, we have 48 patients at the UF Health Shands Hospital. Today's Monday. On Friday, 3 days ago, we had 38 patients. And 1 week ago today, so Monday, November 9th, we had 29. While the raw numbers aren't huge, the mathematical calculations that get us to where we are would tell you that the percent increases are pretty big. And I will always remind us that although we want to talk about rates sometimes and we want to talk about the numbers, today we have 48 people and 48 families that are affected in many ways. And it's something that most of the country is nervous about. The state of Florida is nervous about. This morning I read that the state of New Jersey, the governor is enacting some stricter rules, and that's on the heels of other Midwestern states enacting stricter rules. And so I think we're in for a ride here. Hopefully, what we're seeing today and maybe this week is sort of the next maximum number, and then it comes down. But time will tell. I know there's a lot of fatigue out there. I know that we want this to be done. We want it to be over. I know we're tired of masking. I know we want to see our families for Thanksgiving. We want to get together with people. As I've encouraged you before, I am not going to be able to tell you not to get together with people. I will encourage you to consider spacing, consider outdoor versus indoor, be aware of who you're with, wear a mask when you can, but put all those thoughts together because all those thoughts not only for you are important, but you as an ambassador in our community and as we teach people to think about all of those things. All of you have been through so much. I know it's wearing on every one of you. I certainly have the feeling and the fact that people are burning out, that you come to work every day, that it's stressful, that it's complicated, that you're putting on a ton of PPE, you're taking it off and you're putting it back again, and then you're going home. And if you have children, you're dealing with the bricks and mortar versus not. If you have children, you have to deal with, do they have parties? Do they see their friends? Do they do sports? If you have parents, do you see them or do you not see them? If you're taking care of loved ones, what's their health status? Which I think all this means one pretty simple thing. I don't think you have an off button. You come here every day, you do what you have to do, and it's pretty amazing what you do. And then you go home and you take care of your family. Maybe when you sleep, you get to turn it off. But my suspicion is probably not. So on behalf of the entire administration, I do need to say thank you. I need to say that I remain in awe of what you do. And I do need to say that I feel awful every time I hear a story of somebody that just has to hang it up because they feel that they're tired. I know you're tired. I know you're frustrated. Today, 48 patients are counting on you to make a difference, counting on you to help them go home. Thanks for all you do. I appreciate it.